Hi, my name's Rebecca Brown and I work in public health ethics at the Oxford Uehiro Centre for Practical Ethics. I'm particularly interested in ethical questions that arise during pregnancy and childbirth. I recently published a paper on women's choices in childbirth with a colleague, Andrea Mulligan, and the details for that are below. In the paper, we argued that women should be able to deliver their babies by caesarean section if they wish to do so. When there's no clinical need for delivering by caesarean section, but the woman wants to deliver that way anyway, we call that a maternal request caesarean section. Currently, not all women who want to deliver by caesarean section are able to do so via the NHS. There's evidence that women's choices are not always respected during childbirth. Now, it may be that doctors and midwives think that they know better what is in a woman's interest than she does, or it may be that they're worried about the interests of the baby and they're unwilling to take actions that will compromise this. Caesareans can be dangerous and involve risk for both the mother and the baby, and that's why lots of doctors and midwives think that they shouldn't be performed unless they're medically necessary. But we think that this downplays the risks associated with vaginal delivery, which are often not made clear to pregnant women. The evidence here isn't great, some of it's summarised in the UK NICE guidelines, but it looks like the outcomes for caesarean sections on the one hand and vaginal delivery on the other are comparable. That's to say, neither one is obviously much better or worse than the other. But they are very different things to experience, and the risks between the two different ways of delivering differ. So it should be up to the woman who's going through it to choose which risks she's exposed to. Giving birth can be a positive and empowering experience, but it can also be scary and dangerous. All ways of giving birth are associated with risks, such as severe pain or injury. Some of these can be minor and short-lived, or some can be longer term and potentially life-changing. Doctors and midwives have training and experience which leaves them well placed to advise women on the risks they'll face when giving birth. Ultimately, though, it's the woman who has to give birth, and she should be the one who gets to choose which kinds of injury she's put at risk of. Instead of refusing to allow women to have caesarean sections when they're not considered medically necessary, we should work hard to make sure they understand the harms and benefits of different ways of giving birth and are supported to make the right choices for themselves.